Why should you replace your joint when you can preserve it? How can you know whether you are suffering from meniscal injuries or an osteoarthritis? God has given only a 2 mm thickness of this articular cartilage for the entire lifetime. So how do you think this 2 mm articular cartilage can serve your lifetime of purpose for a pain-free knee joint? Hello everyone. Why should you replace your joint when you can preserve it? So joint preservation procedures can reduce pain and improve your functionality and even can delay or avoid the chance of getting a joint replacement surgery. I am Dr. Gopinath Duraiswamy. I am going to deal with joint preservation surgeries for you. So what is joint preservation surgery? So before understanding what is joint preservation surgery, let me take you through a small anatomical information about your knee joint. So if you see this is our knee joint. This is a model of a knee joint, of a right knee joint. Okay, if you can see this is our thigh bone and this is our leg bone. Wherever two bones unite together or face each other, and when there's a movement occurring there, it is called a joint, just like this. So this is our knee joint, and this is one of the biggest knee joint to bear our weight. Okay, so as I said, this is a model of knee joint. So if you can see clearly, this is a bone, but when it comes near the joint, you can see a small line of demarcation here. This is called cartilage, and when it comes and faces the other bone, it is called articular cartilage. So for any human being in the world, God has given only a 2 mm thickness of this articular cartilage for the entire lifetime. Only when this articular cartilage gets damaged, then we call the knee joint as osteoarthritic. So how do you think this 2 mm articular cartilage can serve your lifetime of purpose for a pain-free knee joint? So that's a $1 million question, isn't it? So the answer for that is God has also created another tissue called meniscus, and here in our knee joint we have two meniscus. One is medial meniscus and one is lateral meniscus, eventually saving your knee joint. So I was talking about the meniscus, right? So meniscus is a shock absorber of the knee joint. So for many reasons, right from our cultural habits of sitting cross-legged or using Indian toilets, or from a small trivial trauma or slip from staircase, or in sports injuries, there is a umpteen number of possibilities for this meniscus to get torn or degenerated with age. So when this meniscus gets torn or degenerated or extruded, just like in lost elasticity of a tissue, it can come out of the knee joint, eventually leading this thigh bone loading directly over the tibia or the leg bone. So that is when the articular cartilage comes directly into contact with the other bone, and due to the weight and the actions what we make, this articular cartilage, which is just 2 mm in thickness, starts getting injured, degenerated, damaged, and whatever it might happen, eventually leading to exposure of the bone underneath it, leading to pain and degeneration. So among the both meniscus, it is the medial meniscus which is most commonly injured because of its anatomical location and the weight bearing axis. So the most common injury to the medial meniscus in a middle-aged people is going to be a posterior horn of medial meniscus root tear. So what happens here is it is attached to the leg bone at front junction and then back junction. So this is called root, anterior and posterior root. So due to the actions or any minimal traumatic event, this posterior root has high chance of getting torn and extruded out. So eventually when the meniscus extrudes out, it leads to severe pain and excruciating pain and limiting the activities of daily living of any patient. Right from the point the meniscus gets torn, the patient will have sudden onset pain, not be able to walk weight bearing, they'll be limping. It will mimic as though the knee is broken or it's completely worn out. So eventually what happens is when any middle-aged woman or a man comes to a clinic complaining of a knee pain, it is generally the doctor gets biased that patient might be obese, they're middle age, they become old, the knee might have got degenerated, but that's not the cause in all times. It is usually because of this acute condition, which is meniscus torn, the patient experiences such an excruciating pain mimicking osteoarthritis. So not all patients with knee pain needs to be osteoarthritic. That is a lesson to be learned from this topic. So how can you differentiate or how can you know whether you're suffering from osteoarthritis or a meniscal injury? So it's very simple. If you are a middle-aged person and if you are quite normal few days back or till yesterday, and this pain has started suddenly all of a sudden, limiting your activities of daily living, if you're not able to walk, weight bearing, if you start limping all of a sudden, it need not necessarily be osteoarthritis, because osteoarthritis is a degenerative process. It's a slow process. You cannot turn grey in a single day. It will take eventually years together for your hairs, all your hairs to turn grey. Similarly, even osteoarthritis cannot set in one single day. It will slowly develop in a way that you will be experiencing mild pain and later on developing severe pain. But in case of a meniscal root tear, the patient will experience sudden onset pain. The pain will be so excruciating that you will feel as if you've broken your bone with no reason. So this is a subtle differentiating factor from the clinical aspect as well as from the patient perspective, that they don't have an osteoarthritis. So now coming to the investigations. When you go to a joint preservation surgeon like me, the doctor will usually examine your knee joint, check for the point tenderness where the pain is experienced by the patient. Then there are some special tests examining or determining whether which is the root cause of the pain. Then the doctor might also ask for a MRI of the knee joint, where it will be clearly differentiated whether it's an osteoarthritic pain or it is a meniscal root tear. Mostly all the meniscus root tears will be diagnosed by an MRI. Now coming to the treatment of root tears, since I told it's a knee joint pain and not necessarily all knee joint pain has to go for a replacement, it's a simple procedure. If at all the patient has been diagnosed with a meniscal root tear, and if that's the root cause of the pain and limitation the patient is suffering from, all the patient requires is a small keyhole procedure called in general terms as joint preservation, or in medical terms as arthroscopy procedure. So what we do is, usually we have a small camera where we insert the camera inside the knee joint. We can go see the entire knee joint within by a LED screen projected by the display in front of the surgeon. Usually the camera will pick up all the signals inside the knee joint and delivers to the TV. Here we will be able to see what is the tissue damaged and how much damage the patient has undergone for. If there's a cartilage damage, we can treat the cartilage condition, and if it's a meniscal damage, we can go and treat the meniscal condition. Sometimes the patient will also end up in having ligament injuries. So the same portal of entry, we can treat many procedures. So coming to this particular point, here when you put in a camera and see that the meniscus root is torn and extruded, all we have to do is go take 2 incisions or take 2 bites in the meniscus and tie to the native footprint where the meniscus was earlier. So in such a way, we are putting back the meniscus back in place between these 2 thigh bone and the leg bone, creating a cushion effect such that these bones don't hit each other and the pain is resolved. It's a very simple surgery which can save your knee. So not all knee pain needs to be replaced. You can even preserve your knee in such a way that a timely diagnosis of this meniscal root tear can save your knee, because if time is delayed, eventually there are many examples to say that the patient who are not diagnosed with a meniscal root tear were eventually pushed to an osteoarthritic knee where they end up in a total knee replacement. So timely diagnosis of a meniscal root tear is very essential. Thank you.